As you know, I've called back the General Assembly to begin on Monday, and I'm going to put something out on Monday that I think will be agreeable. And I want to get the session over quickly and get our budgets done and get the coverage money coming back to Virginia. It is the right thing to do. And as I say, hearing your stories brings, I think, tears to everyone's eyes in this room. I just wish folks on the other side could spend a little bit of time and sit in this chair and hear these stories and get the political, ideological rhetoric. This is not about politics. That's over. The issue of the healthcare law, it's over. It's the law of the land. This is now about coverage and dealing with the law to help our citizens. We've heard so many false things that there's 30% fraud in Medicare. You know what the Virginia fraud rate is today? Less than 0.5%, 0.47. So the argument was, well, this could bankrupt Virginia on the back end. Well, okay. So then the Merck Commission actually asked for an actuarial analysis. I didn't ask for it. It wasn't my account. It was theirs. Price Waterhouse. They did the report. And guess what? Not only would it not bankrupt Virginia in the back end, between now and 2022, we will save the Virginia budget $1.1 billion. Save our budget. Every single major business group in the state, pretty much every chamber of commerce, has endorsed this. So traditionally, many of the chambers, like the Virginia Chamber, is very Republican. They all support it. They understand the issues what this means to us in our future economy and what we need to do. I need, as governor, a healthy workforce. I've got to compete against 49 states every day, and I do this every day, and I relish it. I really enjoy sitting at my desk making these calls around the globe. We already lost a hospital, folks, Lee Regional Hospital in Lee County. It was the biggest employer in the district. They have no hospital now. They have been hurt in Southwest Virginia. They've lost coal, they've lost textile, they've lost furniture. They're hurting rural communities. How can I convince a CEO to put a manufacturing facility in a county that no longer has a hospital, such that their employees will have to get, if they have a heart attack, they'll have to get an ambulance and drive 80 miles or 65 miles. You're tying the arms behind the back. You are really hurting these communities, and the communities who are in most of need of help today. Now, first of all, I should understand that for the first 3 years, it's 100% paid for by the federal government. 100%. So the argument that I've continually used is, why wouldn't we want our sickest Virginians in care when the federal government's paying 100% to get them healthier? That's just common sense. Because today, as you know, with Medicaid, it's a 50-50 match with the federal government. It's our most costly way to do it. And in fairness, what they've done in the General Assembly, at least on the House side, is they've expanded a program which is the most expensive for us. If you want to talk about cost effectiveness, we can get 100 cents dollars and we're paying 50 cent dollars today. I'm going to get this done one way or the other with the help of a lot of these folks in this room who have been so helpful. But we could really get it going probably the fastest to get people enrolled in, what do we think, October 1st? Yeah. Once we get this done, we got to go through the procedure, and then we can get people signed up immediately on October 1st. But being in full disclosure, every day we wait, we are pushing it further and further back. And every day we wait, we're getting outside that 3-year 100% money window. That's why really we need to move very rapidly. But in fairness, reach out to the House of Delegates, to the Republican leadership in the House of Delegates. That's what all you can do is phone call, email. All I want people to do, I'm trying to make sure they keep the politics out of this. This is about all the things, this is about you, okay? I just want them all realize that it's about these folks and to hear these stories. And that's why I'm a little disappointed, in fairness, when they went out sine die the other day. And I thought they would use the 2 weeks to do town hall meetings and do exactly what I'm doing. You know, unfortunately, they've issued press releases. I mean, the most visceral, venomous attacks against me, which is fine. I get it. Don't worry about me. But against hospitals and CEOs of hospitals. I mean, it's sort of a new Republican mantra I've never seen where they're going after CEO pay. I mean, it's they've turned their party upside down. But viscerally attacking hospitals. How can you attack a hospital? And generally, they're the largest employer in these districts. And I wish they would have used this time to do what I'm doing. I've sat in a chair like this. I want you to know, you are not alone. No matter where I've gone, no matter what clinic I have visited, I've heard these stories. I have had people break down in tears saying, I would not be alive today. It is powerful. But you got to hear the stories in order to really understand it. You cannot get these stories sitting in the General Assembly talking to each other. Is that right, Bob?
That's right.
I guess Alfonso and I were talking the other day, they're using $230 million of the Medicaid reform savings in their new proposed budget. So they want the savings to use the savings so that they can spend it on their, not to help you, but on their pet projects. So they want the benefits, and then they say, oh, we got to separate from the budget. Come on. Today. They need specialists today. You need a specialist today. Maria needs a specialist today.
I mean, I'm lucky. I have health insurance, but it shouldn't be a matter of luck. It should be a matter of our state's priorities. And I thank you for speaking up, because you're going to make a difference.
And Charnel is, you know, she and her mother moved, they were homeless for a while.
Yes.
And now she's in the House of Delegates fighting for you every single day, which is great. It's a great story.